Lyme disease awareness, a presentation on Lyme disease and ticks. What are ticks? What is Lyme disease? How to protect yourself and prevent tick-borne diseases. What is a tick? A tick is an arachnid, which means that it belongs to the spider family. Baby ticks, also known as nymphs, can be as small as this dot. Adult ticks may be the size of your pinky fingernail. When ticks are hungry, their bodies are flat. When they have eaten, their body is round, which is called being engorged. Ticks survive by attaching to hosts, animals such as deer, moose, mice, birds, dogs, cats, and humans, and drinking their blood, much like a mosquito, only they stay attached and burrow into the skin rather than bite and leave immediately. Where are ticks found? Ticks can essentially be found anywhere in Canada and many other places around the world. They come on birds and other animals that they feed off of and can fall off of their host animal anywhere. They have a preference for long grass, piles of leaves, and wooded areas, but are also found on school playgrounds and in gardens. What is Lyme disease? Part 1. Lyme disease is one of hundreds of infectious diseases that are spread to humans and animals by ticks. The disease is spread when the tick attaches to a host. It is the most commonly spread disease from a tick. In a very small amount of people who become infected, a rash that looks like a bullseye will appear between 3 and 30 days after a tick bite. This rash means that a person has been infected with Lyme disease and needs treatment. If you get bit by a tick and you do not get the bullseye rash, Lyme disease can be very hard to diagnose and to treat due to a lack of education and awareness, and also due to poor quality testing in Canada. Some things that may happen after you get bit by a tick if you've been infected with Lyme may be that you feel like you have the flu, you have headaches, you are really tired, and your joints may become sore. If Lyme disease goes undiagnosed and untreated, it becomes a chronic infection that you have for the rest of your life. What is Lyme disease? Part 2. Once Lyme becomes chronic, it can cause complications in any organ in the body, including but not limited to the brain, joints, nervous system, and the heart. Because testing is not accurate, and because it often takes a long time to finalize tests or for symptoms to appear, doctors who specialize in study Lyme disease, Lyme literate doctors, recommend having every tick bite treated with 4 to 6 weeks of antibiotics, 6 to 8 weeks if a rash has appeared because the rash is a sign of disseminated infection. The life cycle of the spirochete is 28 days, which is why less than 28 days of antibiotics is not adequate. Lyme disease is often referred to as the great imitator, because its symptoms mimic many other illnesses and it can be very hard to recognize. Many people who have Lyme disease do not look sick and sometimes have a hard time with people not believing that they feel unwell. How can we protect ourselves? Being aware of ticks and knowing where they like to be is important, since this can help you avoid areas that there may be a lot of them, such as wooded areas, long grass, under piles of leaves, and also on school playgrounds and gardens. If you go for a hike, stay on the trail as close to the middle as you can. Avoid going into the bushes. If you are going outside to play or go on a hike or garden with your family, it's important to tuck your pants into your socks, wear light-colored clothing so you can spot ticks, wear a good bug spray, something which has a minimum of 20% icaritin, and most importantly, check your entire body once you come back inside. Ticks like to hide in armpits, in your hair, between your legs, between your toes, and in your belly button. And they can be very hard to see because they are so small. So using a magnifying glass or a light is helpful when checking. Have your parent or a sibling help you in hard-to-see areas like your hair and hairline. Also, putting your clothing in the dryer on high heat after being outside will ensure you kill any ticks that came in on your clothing. You can also buy clothing that is treated with permethrin, which is a chemical that kills and repels ticks, mosquitoes, and other insects and arachnids. Protecting our pets is important too. If you have a pet in your home who goes outside, it's good to talk to your vet about protection for them. Sometimes, if our pets aren't protected, they carry ticks inside our homes on their body, which end up on couches and beds, and can end up on your body too. Lastly, if you've been feeling unwell with no explanation as to why, please see a Lyme literate doctor. Many people with Lyme do not recall a tick bite. Get it right. Treat the bite. No tick bite should be left untreated. The risk of not treating a tick bite is far greater than the risk of treating, since it can lead to lifelong suffering. Not treating and waiting for symptoms to start leaves time for the disease to disseminate, spread, and burrow into different body tissues, which makes it become chronic and incurable. Treating early on every tick bite is the best chance of not having lifelong illness. A 1 to 2 month round of antibiotics is better than a potential for a lifetime of illness and antibiotics. Thanks for watching. Quick facts. Lyme disease is most commonly spread by ticks, but has also been proven to be transmitted to a baby in utero during pregnancy and by insects such as mosquitoes in Germany, which was shown in a recent study. Less than 30% of people who contract Lyme disease get a rash. Symptoms of early Lyme include flu-like symptoms, fatigue, headache, joint pain, nausea, and fever. If left untreated in the early stage, Lyme becomes chronic, meaning you can treat symptoms but never be cured of the disease. Symptoms of late-stage Lyme include memory loss, confusion, tingling and numbness in hands and feet, chronic fatigue, heart complications, depression, anxiety, and sometimes death. Some studies have shown that untreated Lyme can lead to other illnesses such as Alzheimer's, MS, ALS, and fibromyalgia. All ticks can carry many diseases, not just Lyme. Many people with Lyme also have what's called co-infections, such as Babesia or Bartonella. With tick populations on the rise, it's important to be aware of the many infections and diseases they can transmit.